Hi everyone, I'm Dr. Sreejith, consultant cardiologist, General Hospital, Ernakulam. Today I'm going to discuss a few of the latest updates in hypertension. As per WHO, nearly 63% of the total deaths in India are due to non-communicable diseases, and out of which 27% are attributed to CVD. Raised blood pressure is among the most important risk factors for CVD, and poorly controlled hypertension due to low awareness and lack of appropriate care and poor primary care follow-ups are the reasons for CVDs. In India, the prevalence of hypertension is around 38% in men and 32% in women. And despite that, nearly half of people only gets treatment for hypertension, and only half of them are aware that they are hypertensive. The International Society of Hypertension has released the ISH 2020 Global Hypertension Practice Guidelines, which include optimal and essential treatment guidelines. As per the ACC AHA 2021 guidelines, people with stage 1 hypertension, that is the blood pressure less than 130 to 139 and between diastolic blood pressure between 80 to 89, and low risk of atherosclerotic cardiovascular diseases can be managed with non-pharmacological therapy initially for around 3 to 6 months. And if the blood pressure remains uncontrolled after 3 to 6 months, we can consider starting pharmacological therapy. Lowering the systolic blood pressure to a target of 110 to 130 is associated with the reduced cardiovascular adverse events as per the STEP randomized control trial. So it further affirms the sprint findings in a older Chinese population. And when we target these lower BP ranges, the cardiovascular risks are reduced by around 26%. As per the 2018 European guidelines, the diagnosis of hypertension should not be dependent only on office BP recordings. We should more rely on out-of-office BP measurements such as ABPM and HBPM. That is ambulatory blood pressure monitoring and home blood pressure monitoring. It further emphasizes the importance of 24-hour and nighttime BP measurements, which are more associated with the greater risk of mortality and composite CV outcomes. As per the 2018 European guidelines, there are 5 classes of antihypertensive drugs are recommended for hypertension. And as the treatment for hypertension is lifelong, and considering the high non-adherence to treatment, the importance of combination treatment is particularly highlighted. So they recommend to start a combination of ACB or ARB plus CCB or diuretic as an initial therapy. And the HYGEA study, which represents the largest study that tested nighttime antihypertensive treatment, tested whether the nighttime therapy in comparison to usual upon awakening antihypertensive therapy exerts a favorable CV risk reduction. And the relative risk reduction for cardiovascular events was significantly improved for nighttime treatment when compared with the awakening treatment. So the HYGEA study actually recommends nighttime treatment is better than awakened treatment for reduction of cardiovascular risk. And since 2018 July, the products containing valsartan have been recalled worldwide, and the reason is detection of a carcinogen named NDMA in some of the valsartan containing products. And another important study which came in ACC journal is that in people with COVID-induced ARDS, the use of metoprolol can reduce lung inflammation and improve respiratory function. So that these are some of the latest updates on hypertension. Thank you.